Here to help us understand more about B2H and how it works is Mimi Weber, Director of the Bureau of Waiver Management at OCFS. Ms. Weber is responsible for the development, implementation, and overall operation of Bridges to Health. She's worked for New York State OCFS for 10 years, primarily in the policy division, focusing on improving health outcomes for children in the child welfare system. Mimi, thanks so much for joining us today. Why was Bridges to Health created?
Sure. Bridges to Health was created because children and youth were coming into the child welfare system as well as the juvenile justice system with significant mental health needs as well as developmental disabilities and chronic medical conditions that the system simply was not able to handle. In addition to that, the traditional community healthcare system was not equipped and continues to not necessarily be equipped to handle these significant needs of kids and youth in the child welfare and juvenile justice system. So it was created out of concern and out of a lot of frustration that we needed to do a better job in serving these highly vulnerable children.
Mimi, tell us about the unique and special needs of children in foster care.
There's lots of studies that talk about these unique needs. We know from the literature that half of children in the foster care system have one or more mental health need. In addition, we know that the incidence of post-traumatic stress disorder is 5 times that of the general population, and about 2/3 of children in foster care exhibit a developmental disability and at least one chronic medical condition. Another quarter of children in foster care are diagnosed with 3 or more chronic medical conditions that require ongoing treatment. And a majority of children in foster care require enhanced educational services. It's also an exciting time because there's an emerging literature that talks about developmental trauma disorder and ambiguous loss. These two diagnoses combined more accurately describe the unique needs of the child welfare and the juvenile justice population because it takes into account the ongoing abuse that our children are apt to have endured during their lifetime. What we know from developmental trauma and ambiguous loss is that the child welfare population tends to have experienced communication delays, cognitive delays, motor delays, and language delays. And Bridges to Health we're hoping through the implementation of Bridges to Health that we're able to fill some of these gaps and support healthy coping mechanisms that last a lifetime for children.
Now, Mimi, what are some of the previously existing barriers to integrated services, and how does B2H address those barriers?
Sure. The major barrier is the lack of resources that are available to local departments of social services, including the Division of Juvenile Justice and Opportunities for Youth, as well as our network of voluntary foster care agencies that serve the child welfare and the juvenile justice population. Bridges to Health intends on filling those barriers through the provision of what I like to refer to as non-traditional services provided by non-traditional providers in non-traditional locations. The traditional Medicaid system is a highly complex system, and Bridges to Health is hoping to tear down those barriers and that complexity to service provision.
Mimi, who sponsors Bridges to Health and whom does it serve?
Bridges to Health is approved by the federal government and is administered by the Office of Children and Family Services, the Bureau of Waiver Management, in collaboration with our regional offices and our partners at the New York State Department of Health. But the heart of Bridges to Health is administered through our partners at the local departments of social services, including the Division of Juvenile Justice and Opportunities for Youth, and the network of service providers that have risen to serve our most vulnerable children.
And whom does it really serve?
Bridges to Health serves 3 unique types of children in the child welfare and the juvenile justice system. The first group of children that we are hoping to serve are children in the system with serious emotional disturbances, or children with developmental disabilities, or children with chronic medical conditions.
Okay. Well, the B2H program currently offers 14 distinct services to foster care children and their families and caregivers. The B2H services are healthcare integration, skill building, family caregiver supports and services, intensive in-home supports and services, special needs community advocacy and support, crisis avoidance, management and training, crisis respite, planned respite, dehabilitation, pre-vocational services, supported employment, immediate crisis response services, adaptive and assistive equipment, and accessibility modifications. Mimi, so many of these wide-ranging services go beyond just the direct care of the foster child.
They absolutely do, and we're so proud of the fact that we're, through Bridges to Health, we're not only able to serve the child, but we're also able to serve the network that surrounds that child. And so through the implementation of Bridges to Health, we're able to serve that foster family where that child resides. We're also able to serve the birth family and the siblings within that network. Another fascinating aspect of Bridges to Health is we're not only able to serve the child while they're in the foster care system or the juvenile justice system, we're able to extend these services beyond their stay in the system up until the age of 21. So our ability to provide ongoing services to the child and family is dramatically enhanced.
Mimi, in addition to avoiding institutional medical placement for these children, what are some of the positive outcomes that the B2H program is hoping to achieve by providing these services?
Well, as you said, our primary goal is to reduce the need for medical institutional placement, but there are a series of other outcomes that we're experiencing. We're seeing that children do not have to rise to a higher level of care. We're able to stabilize their placements in a foster boarding home or a therapeutic foster boarding home or even a group home as opposed to having to reside in an institutional placement. We're also seeing activities that enhance our ability to achieve permanency that much sooner. We're seeing children move to adoption with Bridges to Health services, and that's a very exciting opportunity for us.
Now, if a foster child is already receiving child welfare services, will he or she still be able to receive B2H services as well?
Absolutely, absolutely. B2H services are considered to be additive to the child welfare system, to the child welfare foster care system, as well as to the juvenile justice system.
Right, so we have that nice enhancement there. Well, Mimi, thanks so much for being with us. That brings us to the end of this introduction to the Bridges to Health program. In Chapter 1, we will review eligibility requirements for B2H.